Doctors of Reddit, who has been your worst? But I looked it up on WebMD patient. Serious answer, I try to ask my patients if they have googled their symptoms. It gives me a lot of information about what they are worried about. I then try to stay humble about their findings, and try to not be a jerk about that. Trust is not built by telling people they are stupid. However, it is hard to keep a straight face when a 50-year-old male walks in and says I think I have caught the Down syndrome, or when a young woman thought she had testicular cancer. Can you elaborate? What exactly made them think that? Well, she found a lump on her testicles. Family physician here. It happens quite often actually. A patient swears the problem is something it isn't from something they saw online. But my worst case was when I recommended a vaccine and the kid's parent just had to be an anti-vaxxer and flipped out, spewing bullshit from her 30 seconds of research. OMG, how do you deal with anti-vaxxers? It's crazy. I'm a teacher and it drives me insane when parents say that. I just calmly try to rationalize what they say, tell them how vaccines are good, and tell them that whatever they heard in their anti-vax mom group is completely false and that a Google search is not the equivalent to someone with several years of medical experience. I'm an RN in pediatric neurology. We frequently have families who refuse to put their kids on seizure medications regardless of the EEG findings and the fact that they, have seizures and stuff. One family did the research and attempted to cure the child's epilepsy with essential oils, over-the-counter CBD oil, yoga, metal iron wristbands, to balance the brain. They even went as far as having the kid's dental fillings removed and replaced with a non-metallic filling. There was the time that someone told us she didn't need medication because if you opened a fizzy can of Pepsi and put it under her nose she would come out of a seizure. If that didn't work, you could whisper Reese's Pieces in her ear and she would stop seizing. My least favorite visits are from parents who refuse to believe that their kid is twitching because they have motor tics and likely Tourette's instead of epilepsy. Like, if it was a choice between Tourette's and epilepsy, you should choose Tourette's all day long. Why these parents are hell-bent on giving their kids a diagnosis of epilepsy is beyond me. I just don't even know anymore. Just graduated medical school a few weeks ago. The most frustrating are the concerned parents who buy into all sorts of myths regarding vaccines. Especially frustrating are the parents who refuse the HPV vaccine for their daughters and sons, not based on any misguided health concerns, but instead due to beliefs that it will encourage their daughters to be sexually promiscuous when they are older. This will make my friend sound stupid, and she really isn't. When she had her first baby and was in that woozy sleepless new mom phase, she took the baby for her checkup and completely misheard when the doctor told her the baby had eczema. She got home and started googling what she thought he had said, and called me in a panic, saying, "The doctor said the baby has emphysema." Why? That infant never smoked a day in her life. Not a doctor, but I am a pre-med student who comes from an anti-vax family. Occasionally someone will send me a link to research, usually a mom blog, about why vaccines are terrible. I had a woman come to see me because of abdominal pain. I spent a good 10-15 minutes of asking her questions to get a better understanding of what could be happening. I ended up ordering an ultrasound to assess for an ovarian cysts and some blood work. As she's leaving she goes, "Are you doing lab work for my prostate?" I had to bite my tongue so as not to laugh and said no, because you're not a male and you don't have one. She just said oh and left. Spoiler alert, she had an ovarian cyst. Obligatory, not a doctor, but I have a relatively rare condition. So when I go to the doctor, more often than not I see them pull up what? Oh yeah, WebMD and Wikipedia. And then they read exactly what I just told them. RIP. Not a doctor but worked in emergency services. Guy went to bed after convincing himself that his chest pain was indigestion. Took some antacid and climbed in bed. Wife was in tears the next morning when he was dead. Veterinarian here. This is the worst I ever had, but not because they were wrong. A large lady wearing a muumuu brings a kitten into the clinic. She plops the kitten onto the examination table and says, "Pretty sure it's got ringworm." I examined the kitten, and sure enough, it has a couple of classical ringworm lesions. Too young to give oral antifungals to, so I prescribe a topical therapy for it. Large woman asks if that would work on human skin too. I say it should. She says good, because the reason she knew the kitten had ringworm was because she found a lesion on her own body that she looked up on Google, and it looked like ringworm. And before I can ask anything further, she flops out one large, saggy and obviously non-brassiere supported tit through the neck of the moo to show me the ringworm lesion on the top of her left boob. Yes, that's a ringworm lesion on your pendulous breast. Now please put it away. RN. But my favorite was when a patient's family member rudely insisted we give her mother, who had a major stroke, resulting in nearly zero swallowing capability, as much water as she could drink, because I read a study online that said you can't aspirate on water because your lungs just absorb it back into your bloodstream. I looked her dead in the eyes and said okay, then explained drowning to me. I'm not a doctor, but I did take my very elderly nana to the hospital after I showed up to her house and found her slurring her words and behaving very strange overall. Now, my nana is a major hypochondriac, and when she was admitted, the first thing she told the doctor is that she believed she was experiencing the beginning signs of Parkinson's. It turned out that she had mixed up a bottle of non-alcoholic wine with a bottle of regular wine, had drank the entire bottle, and was completely hammered. Not a doctor, but when I was in middle school the internet led me to believe that it burned when I peed because I, who had not so much as held a girl's hand, had syphilis. Turned out I was just really dehydrated. Edit, I now realize I remembered wrong. It wasn't the internet that made me think this, it was those bullshit seminars they had show up at school that try to teach children not to have sex because if you do you'll catch babies and the AIDS and then die. I'm sorry this doesn't answer the question, but it's related and I'll say up front. My fiancée is a nurse and she and her nursing colleagues have all agreed I was well within my rights to be the asshole in this scenario. I'm usually extremely polite to everyone, but you know. Pain. I went to the emergency department because I couldn't move anything above my waist and was in horrific agony. For no reason whatsoever my back stopped working. This was on Christmas Eve and left it till the 28th to go in. Go into Tridge and I'm waiting around 4 hours, still in pain and trying to move in any way. Eventually Tridge nurse shows up. So, what's the problem there? Back is in agony, can't move. I haven't injured it. Think it's maybe a slip disc or trapped nerve or something. I'm not sure. Are you a doctor? You are not, are you? So don't come in here trying to guess what it is. Okay. Are you a doctor? She stormed out without saying a word and the doctor came in 5 minutes later, took a look and determined some swelling had trapped a nerve, heavy duty diclofenac, and I could have danced 30 minutes later. A mother who was convinced her son had familial Mediterranean fever. He did not. She was repeatedly told this, nicely of course. Yes, the child had had genetic testing by the time I saw the family. Oh, but a small percentage aren't detected by the testing. Thing is, her kid was fine. Healthy kid. Mom was just obsessed with this diagnosis, not exactly Munchausen by proxy. She never did anything to him to make him sick, or subjected him to a lot of unnecessary procedures. But on that spectrum. Well, the opposite. When I was 17 I went to the doctor because it hurt when I peed. I had the assumption it was a UT. When I went into the doctor and told him that, he proceeded to tell me that there is no way it could be a UT since I am a male and 17. He then asked me if I was sexually active and I said yes. He asked with partner? I said yes. With protection? I said yes, always. He told me, oh, you definitely have an STD. Ran all the tests and came back with such a look of defeat and told me I have a UT. Take that, you judgmental dick. Follow up on a recovering triple bypass patient. Was giving the general you should try to eat more healthily, watch your weight, take moderate exercise, avoid smoking sort of thing. Resulted in a 5-minute harangue about nanny state doctors telling us what to do and denying us simply pleasures. Healthy at any size, internet says so, just bad luck, stop interfering. I appreciate that there is a time and a place for unsolicited lifestyle advice relating to cardiac health, but an appointment with your physician to discuss your recovery from a coronary artery bypass is at time and that place. Some people are beyond help. Thanks for watching. Please like and subscribe if you enjoyed.